Well, this year, 2014, the 8th summit of NATF is going to be the best one ever. We're going to have a special patient advocacy dinner session, and our keynote speaker will be John Finicos, who is in charge of Brigham and Women's Hospital Pharmacy. The theme is going to be how patients need to have an important role in deciding what therapy they choose. In other words, we no longer have this paternalistic model in medicine. Now we have a collaborative model. And we're going to delve into that, and we're going to have a few patients also talk about what it's like to collaborate with their healthcare provider. This is all leading up to the Saturday morning summit that will be at the lovely Fairmont Copley Plaza Hotel, where we've held our summit every year. We're going to talk not only about pulmonary embolism, but also about stroke prevention and atrial fibrillation, the novel oral anticoagulants as a new class of medication, and acute coronary syndrome, heart attacks. And we're going to have our keynote Sahara lecturer in thrombosis. That will be Dr. Paul Ridker, and he's going to talk about this important link between inflammation and thrombosis. I can't wait to hear his lecture. I'm going to speak at the summit about this important issue of how we minimize bleeding at the time of surgery or other procedures that need to be done on patients who are taking anticoagulants. Well, this topic is very important because on one hand, we don't want to have extra bleeding. On the other hand, we don't want to stop the anticoagulant and have extra clotting. So it's how do you walk that tightrope in between to get the perfect balance, and that will of course be of major interest to patients, their family, the public, and to all healthcare providers.